You're listening to Parents You've Got This, the expert guide to parenthood, the complete guide to fertility, pregnancy, birth, baby and parenthood. This podcast is proudly supported by Mistela, a natural origin skincare for babies and children, recommended by healthcare professionals. Mistela by Parents' Side since 1950.
Nipples and breasts go through a vast array of changes through pregnancy, birth and beyond. Today we have our lactation expert Rowena Gray back in the chair to talk to us all about nipples and breasts.
Rowena Gray is an international board certified lactation consultant. She is a midwife, she is a mother of three, and she is a published author of her book, Born to Breastfeed. Thank you so much for being with us again today, Rowena. We love sharing your information far and wide, and this topic is such a great, juicy one, so we're really looking forward to delving into it. Let's start with nipples. So nipples come in various different shapes and sizes, don't they? Can we talk a little bit about what's normal and how all the different things that you see with nipples?
It is a good question. What is normal? Nipples come in all shapes, sizes, directions. We're all different, and it's quite common for mums to have two completely different nipples on their same chest. So yes, a whole range of normal. Most nipples will do the job.
And what changes happen to nipples during pregnancy?
A lot of changes happen in pregnancy. One of the biggest noticeable changes is the hormones of pregnancy make your nipple and areola get much bigger and get much darker in colour, because baby can only see black and white, and it's the kind of homing beacon once baby's born to look for the nipple. Pregnancy hormones also create a whole lot of changes in sensations in the nipples, so they can be really, really sensitive, like sometimes so sensitive that you can barely touch them. Sometimes too, milk starts to leak in pregnancy, so a whole lot of changes happening.
What about nipple anatomy when you're actually breastfeeding, when baby's arrived?
A lot of people don't really realise that you can have a whole different number of holes in the end of your nipple. So on average, mums will have between 5 and 9 holes in each nipple. Wow. And it's also quite common to have more holes in one and less holes in the other. So one breast will flow more readily than the other because it's easier to flow out of. And other changes with or things that are happening in the breast when you're breastfeeding, when the nipple, when they're having a letdown and they're ready to feed, the nipple can go quite hard, and that can feel really strange, and it happens in both sides at the same time. So one side's feeding and you might not be aware of any changes in sensations because baby's feeding, but the other nipple might be suddenly quite uncomfortable or get a really kind of heavy, dense sensation in the breast. So it can be pretty strange, wild and wonderful sensations when you're feeding.
You mentioned earlier that everyone has different size and shapes of nipples. Does that matter when it comes to breastfeeding?
Yes and no. Most mums and bubs fit together perfectly, even when we all come with different shapes and sizes. Sometimes you might have a mismatch if you've got a preterm baby, a really tiny baby, and you just happen to have quite a large nipple. Sometimes that can be a mismatch. But on the whole, nature doesn't get it that wrong. Most mums and bubs fit together. A baby is super clever and they can work with whatever they've got to work with. There is one style of nipple, an inverted nipple, and that's where the middle of your nipple just pulls inwards and backwards in towards mum's chest. So the nipple does not want to come out at all, and that's different to a flat nipple. A lot of mums have flat-ish nipples, but if you roll them around in your finger or put a pump on or put a baby on the breast, they can actually draw that nipple out. So I'm talking about true inverted nipples that want to go backwards, not outwards, and they are really, really difficult for babies to latch onto. But other than that style of nipple, pretty much any other nipple is workable by a baby.
Let's talk a little bit about nipple damage. When we're breastfeeding, it can happen quite quickly and it can be excruciatingly painful. What sort of tips do you have around how we can avoid this?
So nipple damage, well, it's common. It's not normal. It should not be happening. And damage happens from your baby's tongue or lip or just something around their mouth that is literally chewing on mum. It's not how it should be happening. So get some help to make sure that that latch is going well, helping baby lift their chin, move their tongue well clear of the nipple. But it is quite normal to have some nipple tenderness, really for the first few weeks after birth. There's a lot of hormonal changes happening in post-birth time as well. So lots of tenderness, lots of really strange sensations in the breast when you're feeding. Getting used to that can take some time. But breast milk is a great nipple balm. If there is some tenderness or some blistering or something that just doesn't feel good, breast milk is fantastic. There are a whole lot of other nipple balms on the market that are all really soothing and helpful. And gel breast pads can also be super helpful. The gel in them are actually wound healing gels, and they just kind of melt into the warmth of mum's breast and can be really soothing and help the damage.
Yeah, great. Miss Stella does a great nipple balm as well.
Yeah, don't they?
I really liked.
Yeah. I know, it's funny, in the olden days, my mum was telling me that they used to tell you to get a scrubbing brush or that cotton wool that was sort of silvery, and rub it on your breast prior to breastfeeding to get your nipples ready for breastfeeding.
It sounds tragic, doesn't
it? I was just like, oh my gosh, thank God I don't live back then.
That sounds agonising.
What about cracked nipples? Are they different? If say, it almost splits into like two, what do you do if that happens?
I forgot to mention before about these little lumpy bits that you find on your areola, and they're called Montgomery's glands, and they secrete an oily substance which keeps your nipples nice and moist. So nipples should not be getting cracked or damaged, but the cracking, if they're drying out, is something that we want to try to avoid. Naturally, your nipples are always leaking milk, really, so it is quite a moist area, but if they are drying out, you can put some nipple balm or some breast milk on them.
We talked a little bit earlier about inverted nipples. How common is it? And are there any things that mums can use to help them if they do have inverted nipples?
So inverted nipples are not that common. It's around 10 to 15% of women, but I think it's enough women in the catchment of breastfeeding mums for it to be a little bit of a challenge to feed. And again, I'm talking about nipples that absolutely will not come out at all. So babies just cannot get a grip on the breast. There is something called a nipple shield that mums can use, and it is essentially a plastic teat. So it gives baby something to hang on to. And this is really something that should only be used while mums with mums who have inverted nipples. So as you can see, it just looks like a plastic teat, and these come in various brands. They look in different shapes and sizes a bit as well, like natural nipples do. And so mums would stretch it out and fold it back, and it draws the nipple in to the centre of the shield, and then they can bring it back and it'll fit and sit around the breast. These can be a real pain to use generally because baby brushes their hands or they move their face and they get knocked off all the time. But if it means the difference of baby coming to the breast and able to feed directly from the breast compared to that mum having to pump and bottle because she can't get the baby on the breast, it can be a really helpful thing. What shields are not designed for is for protecting against sore nipples. So sore nipples can be hormonal, but sore nipples are also usually related to a poor latch. And a lot of mums think if this is the nipple, they think they just stick it on like a cap. And this actually creates a bit of a gap between breast and baby and can cause poor drainage of the milk. If the nipple shield is not on properly, baby's going to be rubbing from the outside and the nipple's going to be rubbing from the inside. So you can actually create even more damage than when you started with. So these need to be used with care and be used for the right reasons. But definitely for inverted nipples, it can really mean the difference of a mum breastfeeding directly from the breast or not.
And do you sterilise them the same way that you do a bottle teat or something like that,
So
or are they single use?
These you can use time and time again every feed, and you only need the one shield for both breasts. And you don't need to sterilise them at all. They only come in contact with breast milk, so they just you can rinse them in between time. If you're feeding in quick succession sometimes and you don't get to rinse it, that is okay if there's a little bit of breast milk, still a bit of breast milk residue on the inside. But no sterilising at all, just clean, hot soapy water, rinse, strip dry, and it's ready to go.
Brilliant. So you talked about some of the changes that happen to your breast during pregnancy. What happens once you stop feeding?
So when you stop feeding completely, your breast is still producing milk for about 3 months after you stop breastfeeding. It's kind of like, they're waiting to see if anything changes or if you change your mind. So the breasts, they're still quite busy. It takes a bit of time for them to wind down. And after about 3 months after you finish breastfeeding, you can start to look at going back to your old bras again. You don't need a feeding bra anymore, and your breasts are likely to be back to their pre-pregnant size at around 3 months afterwards.
You mentioned that nipples change during pregnancy. They get darker and whatnot. How do they change after you stop feeding?
They should go back to their pre-pregnant state, so back to the normal size, normal colour. Some mums have noticed though that if their nipples are fairly flat initially before they've had their first pregnancy, sometimes their nipples can still poke out a bit more into their next pregnancy. So that's kind of one change some mums notice, but on the whole they'll just go back to the way they normally were.
And just one more question on nipples while we're talking about them. Why do men have them?
It's a good question.
What about breasts? Do they change after you finish breastfeeding?
So after breastfeeding, your breasts will eventually go back to their same size. Some mums might argue that they don't, but on the whole, they will go back to the same size, and it takes about 3 months for you to stop producing milk completely. So still some fullness and discomfort in the time after you finish breastfeeding, and after about 3 months since stopping, you should be able to go back to your normal bras that you like to have before you had your baby.
So how do you suggest, pregnant mamas actually go about buying feeding bras? Because obviously, the breasts are changing so much and you don't want to end up with a million different bras that you don't fit anymore. At what stages do you suggest that we actually purchase bras that are the right size for that stage?
Well, the biggest part of breast growth in pregnancy is completed by around 16 to 20 weeks of pregnancy. So that is the best time to buy your first, or change to your first soft cup bra. So no underwires after that time, because the wires can press into your breast. You can get mastitis in pregnancy if you're not careful. So soft cups, and you can get some really beautiful fabric crisscross, like nighttime feeding bras where you just kind of pull them to one side. Crop tops are fantastic, or even a breastfeeding bra at that stage. But there will be some more breast growth towards the end of the third trimester of your pregnancy, and that's a time in the third trimester to start looking at actual breastfeeding bras and having a go at practice opening and closing the clips and doing it one-handed and getting familiar with those.
So why do they say you can't have underwire when you're breastfeeding?
So the underwire is, for one, it's actually really uncomfortable because your breasts are really full and can be lumpy and can be hot, but the pressure of a wire under a really full breastfeeding breast can block ducts and end up with blocked ducts or mastitis or worse.
So Rowena, do our breasts ever go back to their pre-baby selves?
We think so.
Just a little bit further down.
A lot of mums will say their breasts are saggy. And if you look at some of the research, they actually suggest maybe age has more to do with the sagginess than the breastfeeding itself. But I don't think we really know. But they should go back to the way they started before you started having children. But you might have some stretch marks that are still hanging around from all their wonderful work that they've done. But they should be back to the normal you.
Amazing bodies.
Well, Rowena, thank you so much for coming on to talk all about nipples and breasts.
A huge thanks to Mistella for sponsoring this episode. Deciding to breastfeed is such a personal decision. If you do decide to breastfeed, give your nipples a helping hand with certified organic Mistella's Nursing Balm. It is made up of 100% natural ingredients. It has no smell, so it won't distract your baby while breastfeeding. It is lanolin-free, and there is no need to wipe it off before a feed. Mistella is our family's favourite.
You've been listening to the Expert Guide to Parenthood podcast, and never forget, parents, you've got this.
Join a Parents You've Got This masterclass today to be prepared, excited and educated for pregnancy, birth, baby and parenthood. Visit www.parentsyouvegotthis.com.au and sign up for a masterclass today.
The information provided in this podcast is general in nature and is intended to support, not replace, a discussion with your doctor or healthcare professional. Parents You've Got This take no responsibility for any medical decisions made by individuals based on the information provided in this podcast.